Now, staying on the topic of health concerns, a shocking number of Americans live with a disease that could potentially blind them.
We had a chance to chat with a doctor who explained the condition and how to prevent any problems.
Well, February, among other things, is Age-Related Macular Degeneration Awareness Month. Here to talk about the importance of catching it early is Dr. Michael Cooney. Good morning, doctor.
Good morning.
So let's jump right in. For people who maybe haven't heard of AMD, that's the short form to say it, what exactly is it and how does it affect our health?
So AMD stands for age-related macular degeneration, which is the leading cause of vision loss in people over the age of 50 in the United States. And unfortunately, it's a big and growing public health problem because our society is aging and age is probably the biggest risk factor. To fully understand what macular degeneration is, you need to know that the macula is the part of the retina that's responsible for your straight-ahead vision. So reading, watching TV, seeing faces, things of that nature. What happens is there are two types of macular degeneration. The dry form, which is what most people start with, which oftentimes has no symptoms whatsoever. And what happens there is little aging changes begin to accumulate in the macula, again, causing usually no symptoms. But about 10% of those patients can convert to what's called the wet type. And what happens there is a little blood vessel suddenly starts to grow in the macula into a very sensitive area. And that blood vessel can wreak havoc by causing bleeding, scarring, and leakage of fluid, which can result in a very significant and profound abrupt loss of vision over the course of weeks to months, if not detected and treated early.
Okay, yeah, that definitely sounds, scary, I'm sure, for many people. Now, what are some of the risk factors of AMD?
So I'd like to break down the risk factors into things you can't do anything about and things you can do something about. So the risk factors you can't do anything about is age. With every advancing decade over the age of 50, your chances of developing this go up significantly. Your family history or your genetics plays a big role. About 80% of your risk is your genetics. Caucasians and women also have higher risk, and you can't do anything about that list. But things you can do something about is stop smoking. Cigarette smoking increases your risk about 4 times, so yet another reason to quit or not pick up the habit. Controlling your blood pressure, exercise, weight loss, good nutrition. And I like to think about all those as anything that's good to protect your heart is usually pretty good to protect your macula.
Okay, and is there anything medically that we can do to treat this?
There is. So if you have dry macular degeneration, a standard of care for some patients is to put them on vitamins, which have been proven through National Eye Institute's trials to be helpful. But you need to ask your doctor if vitamins are right for you. If you have the wet form of macular degeneration, the good news is we have medicines that have been approved by the FDA, which are very effective in stabilizing the condition and in some cases actually improving the vision. For example, there's a medicine called Lucentis, which was approved by the FDA about 10 years ago, which was the first medicine to show that wet macular degeneration vision can improve with treatment in about 35 to 40% of patients. So like most medicines, any medicine can have potential side effects, and you need to check with your doctor to see if these are right for you.
Yes, good point. And speaking of doctors, how often is it that somebody should go and visit the eye doctor?
So the American Academy of Ophthalmology recommends that people over the age of 50 every year should have a full dilated eye examination with an ophthalmologist or a retina specialist to be screened for this and a host of other age-related eye conditions like glaucoma, diabetes, cataract, etc. If you have a family history, it's not unreasonable to start that screening at an earlier age, 40 to 45 years old.
Got it. Dr. Cooney, a lot of important information. I want to thank you so much for joining us. Before we let you go, where can people go and learn a little bit more about AMD?
There's a great website, preventblindness.org, which has a wealth of additional information on this and other topics.
Okay, Dr. Michael Cooney, thank you so much for joining us.
It's been my pleasure. Thank you.
All right, now everybody else, stay where you are. The Morning Blend will be right back.